Good evening, everyone. Welcome to this, our CAWASA series of webinars. This is number 21. And this evening, we have a special guest from CDEMA. That is Ms. Elizabeth Riley, the Executive Director acting. And she joined CDEMA, the CDEMA team coordinating unit in 2001 and was appointed Deputy Executive Director in 2012. She also acted in the deputy position between 2008 and 2012. Ms. Riley has over 20 years experience in the area of disaster management at various international levels. As deputy, she held overall responsibility for the agency's technical coordinating programs and strategic guidance in the areas of preparedness and response, mitigation, recovery, education, and training and information management. At the operational level, Ms. Riley has played a leadership role in the coordination of regional responses to Hurricanes Ivan in 2004, the Haiti earthquake in 2010, Tropical Storm Erica 2015, Hurricanes Joaquin 2015, Matthew 2016, Irma 2017, Maria 2017 in Dominica and so on, and Dorian in the Bahamas in 2019. Her field experience includes the leadership of CDEMA deployment teams in the aftermath of Hurricanes Irma 2017 and Dorian in 2019. Ms. Riley is currently playing a leadership role in the coordination of the region's response to the COVID-19 pandemic. She has written, presented, and published technical papers in disaster management and environmental management whilst attached to CDEMA, and prior to that, during her tenure at the University of the West Indies and the Ministry of Physical Development and Environment in Barbados. Ms. Riley has also lectured in disaster management at the University of the West Indies, Mona campus, and Cayville campus. At the international level, she has contributed to a range of technical advisory committees and is currently Vice Chair of the ICG Caribe Early Warning Systems Group of Experts on Coastal Hazards. She also sits on the Regional Advisory Group, leading the implementation of the regional strategy for Latin America and the Caribbean, and on disaster risk management in agriculture and food and nutrition sectors. Ms. Riley holds an MA in Economics in Environment and Development from the University of Manchester, UK, a BSc Honours in Geography from the University of the West Indies, Mona, Jamaica, and a Master's Certificate in Results-Based Monitoring and Evaluation and Information Systems from the University of Laval, Quebec, Canada. So I now invite Ms. Riley to take the floor, and let's listen, and I hope to have very good contributions from you all from the various territories. Over to you, Ms. Riley, and welcome to our webinar 21.
Well, thank you so much, Mr. Jean. And of course, a special thanks to CAWASA for inviting CDEMA to spend some time with you, the experts in the water resources sector this afternoon. And I'll just share my screen, thank you. Okay, so this afternoon for about, I guess about 25 minutes or so, maybe to half an hour, I'll talk a little bit about emergency management and the water sector in the Caribbean, and just to give some perspectives from CDEMA. And I must emphasize that in having discussions with sectors, the sector and you who work in the sector, you are really the source of the expertise. And therefore, whenever we're talking about conversations that marry sectoral discussions with disaster risk issues, the information that comes from the disaster risk management side is as important as the information that comes from you as the experts in the water utilities, because of course you work there every day and you have the experiences and you have to lead the charge on the whole conversation around resilience. So in the presentation, what I'll touch on this afternoon, I'll share a little bit about CDEMA. I saw some familiar names linked into the webinar this afternoon. So hi to all of those who I may know and who may know me, and to everyone else. So I'll talk a little bit about CDEMA and the agency. Some of you are familiar, I know, but for those who are not, I'll just explain a little bit about who we are and what we do to give a little bit of a context on the water sector in the Caribbean, vulnerability of the water sector, which will be illustrated by some case studies, which we've drawn on. To say a little bit about COVID-19, because I think the hazard of COVID-19 requires a special treatment in a webinar like this, and then some considerations going forward. So we at CDEMA, we are a part of the Caribbean community, CARICOM, and we are the agency that's been mandated to treat all things disaster management. But within our agreement established in CDEMA, there are 5 specific areas that have been highlighted. So on behalf of our participating states, we mobilize and coordinate disaster relief in the aftermath of hazard events. We support our states through advocacy, resource mobilization, and in different ways on mitigating the consequences of disasters. So essentially, we're looking at ways in which we can reduce the potential impact of hazard impacts on our states, including our sectors like the water utility sector. We have a remit also to provide comprehensive information on disasters, and this relates not only to information in the aftermath of a hazard event on what has transpired and the specific needs that are emerging from a participating state, but also we have a remit to act as a repository. In other words, a central space where persons who wish to get information on disasters in the region, whether it be general information, sectoral information, research, can come to. And in fact, tomorrow we're going to be launching a big feature, a new feature for CDEMA, our Caribbean Risk Information System, which is going to house all this information on our website. We also have a responsibility to encourage disaster loss reduction and cooperative arrangements and to make cooperative arrangements and mechanisms to do so. So this really talks about partnership, because the work of building resilience is about working together. And similarly, as you probably all work with your national disaster offices in country, you know that the disaster office is really about coordination. And a lot of work happens actually within the sectors and various other organizations, and similarly at the regional level. And finally, we've been asked to work on the establishment, enhancement, and maintenance of adequate disaster response capabilities amongst our states. And in doing so, we have worked with our countries to set specific standards under different areas of the disaster management cycle. And we support them through in many ways, including through our regional training center, running training courses and various other things, exercises, etc. So as of September this year, CDEMA has 19 participating states. On September the 1st, the Cayman Islands became the newest member of our system. And you can see from the countries here shaded in yellow, the bright yellow, which represent our states, it's a big geographical remit. And so we cover Belize in the west, Bahamas, 700 islands and keys in the north, Turks and Caicos, you notice Jamaica, Haiti, coming around the Eastern Caribbean chain, those countries that were formerly British territories, and including those that are still British overseas territories. And if you come all the way down south, we also have Guyana and Suriname as members of our family as well. And I think the critical message from this slide is really about the diversity of what happens within the CDEMA states. There's diversity in terms of the types of countries that we're dealing with. We have single island states, multi-island states, continental states, one state that shares an island with another. And there's also diversity with respect to the capacities in each of those states, as you will well know, working at the national level. The other area where we find distinct diversity is with respect to the types of hazards that are priority in those states. So some of the states very squarely, as you know, sit within the belt, which is susceptible to tropical cyclones, and certainly we're in the midst of a highly active hurricane season this year. Luckily, we have been spared thus far from catastrophic level impacts. But of course, you know, our colleagues in Belize and Jamaica are this week really seeking to recover from those localized extreme rainfall events associated with Hurricane Eta. And there are also seismic hazards that impact us, and we've had evidence of that. Tsunamis, how historically we know that we've been impacted by those. And there are also the technological hazards as well, including related to oil spills. And you would have seen in the news recently conversations about the FSO Nabarima. So it's a whole plethora of hazards that we face. And then of course, there are those of the biological nature, such as COVID-19, which we'll talk about in a little bit. So in recognition of the vulnerability of our region, and we are one of the most vulnerable regions in the world, we embarked on an ambitious strategic direction in dealing with our vulnerability to hazards way back in 2001. And it's termed our Regional Strategy for Comprehensive Disaster Management, or CDM. This third iteration of the strategy spans the period 2014 to 2024. And you note that the overarching goal talks about delivering safer and more resilient and sustainable Caribbean states. So resilience is really the hallmark of what we do. And in delivering the strategy, which was developed collaboratively through a consultative process with our countries, our sectors, our development partners, and other technical specialized partners, we identified 4 key results that we needed to invest in if we're to talk about building more resilient states. And they address, if you come from the left of the diagram, looking at the red block, rectangular blocks, institutional strengthening. It means we have to have, in essence, stronger institutions. And the institutions refer not only to our national disaster offices, but also to institutions like our water utilities, because all of these organizations really make up the national level system which deals with disaster risk issues. And of course, many of you, as essential services, you will sit on the national coordination mechanisms in countries around disaster risk issues and around response coordination. So you'll be well familiar. It also talks about knowledge management and how we are really making decisions based on evidence, and how we build the body of knowledge around the hazards that impact us, the risks associated with those hazards, and the actions that we should take based on that knowledge. The third area is on sector integration. And since 2007, this has been a major component of the work that CDEMA has been doing, because we are truly married to the philosophy that to strengthen resilience in our countries, we have to strengthen resilience at the sectoral level. And this is both the social sectors as well as our economic sectors, because this is where the impacts tend to affect most when we are impacted by the various hazards. So we have invested quite a lot in mainly 7 sectors, which include tourism, because of its importance, of course, agriculture, health, education, working with our civil society partners, finance, physical planning. These are all sectors that we've invested quite heavily in over the last several years, since 2007. And the final pillar on the right-hand side is one of the most important, because it deals with community resilience. And as we all know, the community is really the front line in the resilience battle. And if we can strengthen the understanding of individuals and communities and the arrangements at the community level, it means that the impacts of hazards from a national or macro scale will be that much more reduced. So we also have cross-cutting themes, and these are indicated across the base in the black. So we talk about gender-related issues, how we're treating with the matter of climate change and how it's impacting on the specific climate-related hazards. In ICTs, which is a critical enabler, as well as environmental sustainability, because of that real intricate interface between disaster risk and environment. I also shared this slide because in the aftermath of Hurricanes Irma and Maria in 2017, the heads of government asked CDEMA the question, you keep talking about resilience, but what does resilience really mean? What does it translate into from the context of our CARICOM states? And so we embarked on a consultative process with our countries and partners to really try to disaggregate what this resilience concept means and where we need to put investment if we're going to say that we are truly resilient. And that consultation and think tank came up with 5 main pillars, which are sewn together by a diversity of threads, which are in the smaller boxes around the 5 main pillars. And even though they're represented as pillars, you know, they're all very much interrelated. So it speaks to social protection for the marginal and most vulnerable, because it is a responsibility to look out for those who may not be in a position to address matters themselves. Enhancing economic opportunities, because we must look at the economic side of things when we're discussing resilience issues. Safeguarding our infrastructure, and this is particularly relevant to the discussion today with our water utilities, because we know in the aftermath of events, we tend to get significant impacts to infrastructure. Environmental protection, we touched on that a little bit in the previous slide, and also operational readiness and recovery, because notwithstanding all the measures that we will take to reduce the potential impacts of hazards that can affect us, the reality is that by virtue of where we live and the types of hazards that we face, we are always going to be facing hazards. So we will always have to respond. The types of investment that we do in mitigation will just move the pendulum one way or the other with respect to the extent of the response. But response is also always going to be a requirement. And once you have undertaken the response, recovery, of course, is the next step. So these are the elements that we came up with. And of course, the importance of being able to measure where we're at in terms of the target set. So in looking at this whole matter, you know, I was reading a little bit more on the water sector in preparation for this, this webinar. And resilience in the water sector is a multi-sector responsibility. Yes, there is an onus on the water utilities and those who have been charged with the regulatory responsibilities related to water. But because water touches every single aspect of our lives, it touches every sector, it means that when we're discussing resilience around the water sector, we have to look at the role that is to be played by multiple stakeholders. So switching now to talk a little bit about the sector itself, and this is of course, information that you know much better than I. So if there are any things that I leave out, please feel free to help my education as well towards the end. So we know the water sector is very vulnerable to hazard impacts. And I'll take you to a couple of case studies in a few minutes. We talk about our states where we have situations of being water stressed as well as water scarcity. And this varies depending on the particular state that you're talking about as you move across the region. We know, of course, that this is a climate sensitive sector, and the implications of climate change has implications with respect to water resources and the availability of water. And also it has implications related to matters of demand as well. We also know that this vulnerability to climate change compounds existing challenges that already exist within the water sector. So in reading, one of the things that was very instructive is the literature that exists with respect to the levels of unaccounted for water, the debate that rages on with respect to appropriate pricing for water as a public good, rather being priced as a public good or as compared to being priced with respect to its own economic value. And there are a myriad of other challenges that already exist within the water sector. And what tends to happen is that when hazard events occur, it exacerbates a lot of these underlying challenges that exist within the sector. So to zero in a bit more specifically, we can talk, of course, depending on the territories, on the lack of high quality and adequate supplies of fresh water. That's a reality for some of our states. We know that water sector infrastructure is a high level of exposure to damage and disruption from water-related hazards. So we've seen that in multiple events across the region, disruption to the distribution systems, for example, also storage facilities, and we'll talk about that some more. There's increasing demand, and this is by virtue simply of demographics in some states. I mean, I know we have different demographic curves that are occurring within our states, but in some states, because of population growth, there's going to be this natural movement towards increasing demand. And then because of the types of economic development that we're exploring in the region, the demand also increases. We mentioned the matters of inefficient water use, and probably we are all guilty of this despite the best efforts of our utilities to move us towards conserving better. We talk about leakage, and this all exacerbates the vulnerability of existing water supply systems and resources. Also, the effectiveness of community and urban water supply systems, these are very much exposed to increasing climate variability as well. Also, some other points on this same theme. Agricultural production is vulnerable to seasonal rainfall and drought, and we know that the agricultural sector is a very important one for us in terms of security. Effective management of our water resources, quantities and quality is being threatened by the changing climate. And then, of course, many of the utilities have faced escalating costs of flood-related damage and losses. So these are just some of the very tangible examples of the vulnerabilities that exist within the water sector. So now quickly, two case studies, which will highlight some of the matters that we've been talking about. So I think one of the classic ones is related to Hurricane Thomas in St. Lucia in 2010. And we know that Thomas, in fact, it was in the category 1, moving to category 2 when it actually impacted St. Lucia. There were multiple sectors that were impacted, as indicated there, agriculture, infrastructure, as well as the utilities. And the government of St. Lucia actually issued a declaration of disaster on the 31st of October 2010. And our own regional response mechanism was placed on standby. I'll come back to response matters a little bit later on and the water sector. So what were some of the direct impacts on the water sector? This is one of the few cases that I've seen in my 20 years or so at CDEMA, that this whole issue of a real threat to the availability of safe potable water to the entire population was one of the results of this event. And the entire population was impacted because of the level of impact to the water sector, including distribution and storage. Extensive repairs were required to the distribution system to make it functional, and there was a significant logistical effort to ensure that adequate supplies of drinking water were made available to the population at that time. And there were also requirements with respect to the need for environmental monitoring and looking at issues of water quality because of the disruptions that occurred. The sustainable provision of safe water and sanitation was a key concern on the island. And I know a lot of times when we discuss the water sector, we give a lot of emphasis to the potable water and not so much to the wastewater components. But the sanitation component, treatment of wastewater, disruption of the infrastructure and facilities for addressing wastewater is also it's a fairly common feature that we have seen in terms of the impact to the water utilities in the region. So specific impacts, 1 out of 28 water production facilities were functioning in the aftermath of Thomas. We saw a situation where river water, persons turned to river water and used this for the purposes of personal hygiene. And of course, there are inherent risks that come with this unless there's an understanding as to how to appropriately treat that water. The water supply capacity diminished significantly in a very short space of time, from 17 million gallons per day to 0.14 million gallons per day. Septic tanks were washed away. Effluent was discharging into drains, so there was a very real health-related challenge associated with this event as well. And similarly, if we look at the case study of Dominica and the impacts on the water sector in 2017, we see, of course, that the sectors, multiple sectors, as you know, were affected, and the hurricane itself resulted in intense storm surge, torrential downpours. We had situations of the rivers, of course, bursting their usual courses and carving new courses, as a matter of fact. And of course, there was a lot of devastation, and including loss of life during Maria. Some of the specific impacts that we saw: production and distribution pipelines damaged or washed away. We had intake systems being blocked with sand and other types of debris that was brought down by the floodwaters. Again, damage to on-site septic tank systems and latrines, sewage system blocked by flood debris, and sanitation damages amounting to an estimated EC 9.8 million. So if we look at that in terms of the actual dollar value, and these are the statistics coming from the post-disaster needs assessment report that was undertaken for Dominique in the aftermath of Hurricane Maria in 2017. And you would see that in terms of water and sanitation, the estimate in terms of the damage and losses to the water and sanitation component of the utility sector was around $64 million US. So in looking at the reports in the aftermath of these events, we tend to see suites of recommendations that emerge in terms of how countries should treat with the particular post-disaster scenario. So I've pulled out some of these on the next 2 to 3 slides or so. So the recommendations around taking quick actions to restore water and sanitation services, solid waste collection and disposal, because you want to minimize the risks related to now the health of persons. Design and reconstruct the water, sanitation and solid waste facilities based on whole project life cycle cost and risk-informed programming approaches. So in other words, built into these recommendations is the notion of building back better and in a more resilient way. The third bullet talks about how we are looking to adopt community water safety approaches to planning and implementation of reconstruction activities with special focus on reinforcement of intake basins, use of flood-resistant pipelines, storage tanks, and protection of water sources. So again, looking at the whole issues of resilience, looking at developing water and sanitation planning, design, and reconstruction unit. So this is now getting into recovery and how countries are recommended to organize themselves around the whole recovery efforts. Included here is talk about the empowerment of communities, including building on local knowledge to improve the integrated water and sanitation management, as well as monitoring and reporting systems. So it's recognizing the role of people who live in the spaces where the impacts have taken place, because they tend to know a whole lot about what can potentially happen and also what has happened in the past. And that type of knowledge is very important to inform how we go about that reconstruction process. It also delves into these recommendations, the whole policy and strategic components, looking at the enabling framework, institutional arrangements, finance, budgeting, planning, capacity development, etc. And at the last bullet here on this slide, cost-effective and resilient systems of waste collection and disposal, including transfer and storage facilities. So we see a whole diversity of recommendations that tend to emerge in the aftermath of these events. And I think the message here is really about what lessons are we really drawing from the events that have taken place in the past as we go about the future planning for the development of the water sector. So I want to switch now to talk a little bit about COVID. And you know, the biological hazards are interesting. When we do the disaster management planning, you know, when we go into countries and we talk about the possible hazards that can impact, you know, in every instance, this conversation about biological hazards, epidemics, pandemics, it always makes the list. But what is very clear is that the way in which we have looked at epidemic and pandemic has not been very robust. So COVID-19 affected our region, and it affected our region at a time when we had a very complex multi-hazard dynamic ongoing. Many of you would recall, because you work in the water sector, and CIMH, of course, has it well documented, and you would be tracking early alerts coming out from CIMH with respect to drought, etc., that 2019 was a drought year. And in fact, we were in the midst of a fairly severe drought in a number of our states. And already there were signs of stress with respect to the water resources that were available. And that in itself was a bit ironic, because the COVID-19 and the associated health protocols that were being recommended for frequent washing of hands meant that you're strapped in terms of the water supply at a time when the demand for water naturally must increase. And in fact, a colleague of mine from one of the water sectors was saying to me that they saw 3 to 4 times the increased demand at one point during the height of the COVID pandemic, when persons were really adhering to the recommendations about the hand hygiene and the need for frequent washing, etc. So we also were about to embark on a very active hurricane season. And in fact, this is one of the things that has really a real level of complexity, certainly for the disaster managers, and I'm sure also for you as water utilities, because annually you do have to plan for the cyclones which potentially can impact, or the severe weather events. And even in your planning and looking at the ways in which you're going to respond or even to operate in that scenario, it means that there's a need for adjustments. And I'll come back to that in a few minutes. The other thing that we saw as a feature of COVID-19 with respect to the water sector is this whole conversation around water as a human right. So one of the interesting features, and in my view, it was a very appropriate feature as well, of the conversations with the water sector at the policy level in countries, was about those decisions to ensure that persons had access to water, even if they did not, one, have the capacity or ability to pay, or two, the wherewith or the desire to pay, whichever one it was. But policy decisions were taken very early, and this is almost across the board in our CARICOM states, that water needs to be made available to persons, and all efforts were made to do so. Persons disconnected were reconnected, whether or not they were able to settle their bills, etc. And of course, this has implications for the water utilities, because there's a scenario here where the utilities still have to meet their costs, but because of this whole, and you saw in our resilience diagram, we talked about looking at the whole needs of the vulnerable and the marginal, but this social dynamic is very important when you're looking at the management of these types of events, because it's a government responsibility to make sure that certain basic human rights are provided at a time that's required. And I know you probably have a lot of discussion around that and how long it should persist and that type of thing, but the reality is this is what happened. We also saw that there was very varied level of planning for pandemics. So I mentioned before that, yes, pandemic and epidemic is mentioned in a lot of plans, but it has not been given a robust treatment. So in many instances, institutions were, and I will deliberately use the word scrambling, to really put plans in place to address the reality of what pandemics meant. And if your institution was in that position, don't feel alone. It happened across the board. We also see within the water sector modified operations. So we are in a situation now where in many of our utilities, I'm sure, and I've been tracking a few of the webinars by CAWASA and others, just listening to some of the experiences. And what's very clear is that in situations where your headquarters or your sub-offices had open office plans, which were now in breach of health protocols, you had to modify. You had to modify. Countries went into lockdown. Yes, the water utilities are essential services, but still decisions had to be made with respect to, even within an essential service, who are those essential personnel who actually need to come out and come in, as opposed to those who can work remotely. Some utilities had already arrangements in place to facilitate remote work arrangements, some did not. So it really caused a period of very rapid adjustment, not just for water utilities, but for other institutions as well. The orange box in the middle is a really important one that I want to raise, because, you know, we're still in the midst of the COVID pandemic. We're having very diverse experiences if you look across the CARICOM states, and I'll come back to that in a minute when I talk about the dynamic situation. But what I want to zero in on here is that the fact is that most of our states have one water utility company. And you are very special, because within water utility companies, there's not a lot of redundancy in terms of the types of specialized skill sets and experience. And so this question of protection of your human resources is a very real conversation in COVID-19, because we also know a characteristic of our region is that we have one of the highest NCD incidences in the globe. So if you look at the rates of diabetes, hypertension, heart disease, it is not unusual that you will find persons, including those working within the utilities, who may also have these very specialized skill sets, also having these comorbidities, which make you highly susceptible to the COVID-19. So this issue of the protection of the team is very important. And I think, you know, even if you look at the global experiences, I think Boris Johnson, PM Boris Johnson in the UK is just a classic example about the need to protect your team, protect your leadership, protect the critical personnel that you have, because water utilities are very unique. And I think this is something that we have to face very squarely as we're doing the planning and how we treat water utilities, and very importantly, the people, because it's really the people who deliver that service to the population. Also, this issue of varied risk perception. And, you know, this is an interesting one, because, you know, it is always interesting to see how human beings interpret situations in a very different ways. So there are people who think, oh, COVID is out there, but I can't get it. So there's a very low risk perception. There are those who are on the other extreme, who are fully digesting every word coming out of the health authorities, and they're washing their hands 100 times a day. They're staying home and they don't have to go out. The mask wearing is an absolute must for them, and they're not mixing with people, they're distancing as required, et cetera, et cetera. But this varied risk perception is something that you see at a national level if you look across the population, but you also see it within institutions, because institutions are made up of people. And I think this is something that we have to think about, and it's very much linked to this point about the protection of the team. And even to some extent, the gender dynamic comes into this conversation because of how differently, and this is a proven research fact, males and females may perceive risk. So I think this is a component that utilities need to look at. At the bottom now, this matter of the dynamic situation. So what is happening is that the situation in a given country at a point in time with respect to COVID-19, it can change in a flash. And we have seen it take place. We've seen it, unfortunately, for our sisters and brothers in the Bahamas, where the situation very rapidly got out of control, and they're working very hard now to bring things back to a level where they're able to manage it more easily. In recent weeks, within the last 2 weeks, the situation in St. Lucia, I think, is foremost on the mind of our Caribbean people if we're tracking what's happening. But we're also seeing other hotspots in the region for varying reasons. So you have those territories that have shared borders, in which the movement of a person across the borders is not fully policed for very practical reasons because of the size of these shared borders. So places like Guyana, Suriname, and Belize are having some challenges. We have situations like Trinidad and Tobago, where displaced persons who've been displaced because of challenges in neighboring Venezuela, it is suggested that they are providing some measure of impact to what's happening with the COVID situation. I don't have that in a research piece, but this is something that's been discussed by the authorities in Trinidad and Tobago. So, and LinkedIn then with this situation about the varied risk perception, where members of the population may not necessarily feel that they need to adhere to these protocols that are out there because they simply don't see this COVID thing as something that's going to impact them, that low risk perception. So all of these are very complex issues that are coming into the mix with respect to COVID. So what does it say though? It says that flexibility is required because the situation keeps changing. It means that as persons who are in charge of institutions, water utilities, other types of institutions, as management and as leaders, we have to read the situation, anticipate what is happening with it, and make adjustments to suit. And the adjustments need to be made in a timely manner as well. So even as we go through the rest of the pandemic, and certainly COVID, we are coexisting with COVID, we have to. I saw the great news about Pfizer and the 90% success with the vaccine trials, but the reality is, and I know you've probably been following the conversation, that the availability of the vaccines is not going to be immediate. And certainly when the vaccines are made available, one of the things that will need to be looked at is how from the policy decisions that are being made in terms of the prioritization of who gets vaccines, and certainly essential services like water should be high on the list for being able to access vaccines when they are in fact available and confirmed as being safe. And that last part is a very important point, because I know this is something on the minds of lots of people. And this may generate some conversation. I'm happy to discuss to the extent I can, because of course I'm not a medical doctor. So I wanted to touch also on the response side before I go to the final slide and talk about some recommendations and things that we have to talk about for the sector going forward. And this is a simple schematic of our regional response mechanism. And essentially, this is how we treat our mandate for coordinating disaster relief and response, which you would have seen on one of the first slides that I showed. So we have what is called this regional response mechanism. And in essence, it's coordinated right here in Barbados through our regional coordination center. It's a physical space, but it can also be a virtual space. It's held together through a governance structure where we have regional plans. Each of our countries has national disaster plans, which speak to what triggers the regional plan, and we speak to how we would support the countries. We have specialized plans. We work with our donors and tie everything together with memorandum of understanding and operational procedures. We have sub-regional focal points. Some of your countries are sub-regional focal points. That's Trinidad and Tobago, Barbados, Antigua, Barbuda, and Jamaica. And in each of those sub-regional focal points, we also have sub-regional warehouses and other arrangements that are put in place to support states that are impacted. But importantly, we have regional response teams. And I wanted to raise this in the context of the water sector, because in the aftermath of Irma and Maria in 2017, we initiated a conversation which I hope we can move forward as well in terms of how we can coordinate surge support for water utilities in the same way that the electrical utilities across the region have come together under the umbrella of CARLEC and have surge support response arrangements to assist their sister utilities if they're impacted. So I do think that this is an opportunity which still exists, and the water response, surge support teams, whatever you may wish to term them, can slot very nicely into the the regional response mechanism framework. So final slide, considerations going forward. Well, one, that resilience is where it's at, it's where it starts, it's where it continues, it's where it has to end. And the treatment of resilience is required within water utilities from a policy perspective, but also from nationally, from a cultural perspective, because it means we have to do things differently. And it may not be easy for us to do things differently because we've always done things a particular way. But I think this is something that is an absolute must. Within the water utilities, the multi-hazard approach is critical. And one of the things that I'm seeing, and it's very much connected to this point below here on the opportunities, innovation, and investment, so I'll speak to this now. One of the things that I'm seeing is that because water is a climate sensitive sector, there are a lot of resource mobilization opportunities that are opening up to water sectors, which of course you need to take advantage of. So we see, for example, the government of Barbados had signed off, I think a couple of years ago. I see Alex Eiffel online, so if I'm wrong with the year, Alex, you can correct me. I think it was about 2 years ago or so, 2018, there was this sign off of, I think it was a 45 million green climate fund initiative for looking at resilience in the water sector in Barbados. And BWA, of course, is the key beneficiary and I believe the main implementer of that initiative. I also saw when I was researching that the Bahamas has submitted, I think it's about a 26 point something million US dollar proposal to the Green Climate Fund, also looking at this issue of resilience of the water sector. And the climate component, because your climate sensitive sector is very important. But what I think is also important is that even in implementing initiatives, such as coming through the Green Climate Fund, the multi-hazard approach still has to be factored in. So earthquakes, for territories that are impacted by earthquakes, they're not gonna go anywhere. And they can also impact the utility. So I think these big opportunities that are coming through the climate related funds, the advantage really has to be taken to try to make the sector more robust from a multi-sectoral perspective and not just from the perspective of the climate related hazards, which of course I do not at all diminish the importance of them, but I'm just saying let's have that additional value added of looking at the other hazards as well. And as you can see, even in dealing with pandemic, there's a requirement for innovation. And there's a lot of opportunities that arise from hazard impacts, including from the pandemic. I'm sure many of your utilities, as for many other institutions and organizations, have been pushed or shoved forward with respect to ICT because you have had no choice but to do so. Business continuity plan, of course, is important. Operational readiness is critical. We talked about the surge response arrangements and recovery planning, absolutely, absolutely critical. And I want to also emphasize research because of the importance of having that evidence base for how you're making the decisions. So I took longer than I had anticipated. I hope that the presentation was informative, and I'm really happy to take any questions or to hear your comments or thoughts on anything that I have shared.
Right, thank you very much, Ms. Riley. This was really a very fascinating journey, and I think that our operators here would have had some good perspectives on some of the requirements in going forward as far as our responses to COVID and other hazards. I think I noted that you mentioned some of the things. I noted that yes, the Barbados Water Authority had this US 45 million GCF, I think about 2 years ago, that was announced. In Grenada, CAWASA Also had I remember with the GM over there when they got news of they had received approval for that project. And yeah, I'm just learning about the Bahamas one. And I think there are other countries who are now developing some of these proposals to send off to the GCF. I think there was, I haven't seen any questions in the chat room, but please certainly, colleagues, do put up your questions or let me know if you would wish to make any comments or observations or questions you have. Also, we are without it seems, a lot of our Cayman operators today because they were too affected by ETA. And now I saw somewhere in the mid-Atlantic there is theta, so we are 29, and that's a record for this season. I think there was something that I wanted to raise as far as I've just made a note of it. I'm just trying to scramble and find it quickly. You mentioned in building back better. What sort of experiences that you've seen? I know that particularly after an event, people are usually, or utilities are under pressure to get water back to the citizens as quickly as possible. And sometimes utility managers are forced into a position of maybe not using the optimal infrastructure to build that better. So the better is left out in terms of expediency. And then you forget that by the time you get into the next storm. So what are some of what you've, in your own experiences around the region?
Mr. Jean, you may know that even better than I. I think the only thing that I can say is that your observation is similar to ours. And I know that it immediately in the aftermath of events is a very challenging time. And you tend to see that a lot of what are intended to be temporary fixes become permanent fixes. Sometimes you see situations where unfortunately, vulnerability is rebuilt in terms of how you see repairs to the water sector. I know for some of the territories, there are a lot of challenges because sometimes there are minimal options in terms of how you actually go through that reconstruction process. And I mean, in every severe weather event that we've seen in the volcanic territories of the OECS, for example, because there's almost no choice in terms of where the distribution systems can run. And they usually will cross the rivers, you know, so you get these scenarios of the repeated losses from the events. And I don't in any way think it's an easy matter to deal with. Of course, the engineers are best positioned to make the recommendations with respect to how you can harden the infrastructure as you replace it. But it is not an easy matter to deal with because of expediency. So I don't know what to say beyond that. Maybe some engineers are online and maybe some persons who have worked in those repair situations in the aftermath of those types of events and maybe can shed some light on that matter. Over.
Yeah, I know this is a difficult one in as much as it is planned. The other question was to do with the water as a human right. Only yesterday we had a grouping, had some discussions with ourselves and the CWWA, and highlighting, particularly in the light of COVID-19, and as what obtained in some of the jurisdictions, but not so much in the Caribbean, where the governments, as you indicated, and even the utilities, you know, abandoned any disconnections because they wanted to be sure that all citizens had access to water. But do you think perhaps in the future we need to consider because I know in many of the bits of legislation that exists on water, it does not, or even in our constitutions, it doesn't explicitly define water as a right. What are some of your experiences, and do you think there's a need for us to consider going in that direction?
That sounds like a trick question, Mr. Jean. I would say, I mean, the recognition of water as a basic right is actually articulated under the Millennium Development Goals. If you check the language there, and I mean, you certainly don't want to be denying persons access to something that is essential. I do think though that there has to be a balance, because I feel that, and I guess the utilities could probably speak to this, but I get the sense, and this is just from anecdotal conversations with persons in the water sector, etc., that even in instances where persons have ability to pay, sometimes people are making choices not to, and sort of ducking under the cover of the policies that the water utilities and governments have adopted at that point in time. So, and I in no way am I diminishing the reality that many of our countries have gone from less than 10% unemployment rate sometimes to 30-something%. In the case of one of our territories, I believe it's up to 40-something% unemployment. In no way am I diminishing the reality of that. But at the end of the day, there's going to be a need to look at mechanisms to make sure that water utilities survive. So, and in a lot of cases, the utilities have been asked to ensure that because they're statutory, a lot of them are statutory, so they have a requirement for their own generation of resources, etc., and to deal with their own issues of financial survivability. But there may come a time when there has to be a conversation with respect to how the intervention level may also look at this whole issue of survivability of the water utilities through subsidy or something like this, because as you can see, this COVID situation is not going to end tomorrow. In listening to my health colleagues, and I meet with them every 2 weeks on the COVID situation across the region. And what is very clear to me is that we are in this for the medium term. So I don't know if discussions have already started at the national level with governments in terms of what kind of assistant packages can be provided for water utilities. I mean, I think this is something that is as urgent as bailout packages or support packages for persons who are now unemployed beyond the whatever time frame it is that the social security mechanisms are providing the support, because you now really have to look at ways of how do people survive. In that same way, you need to make sure your utilities survive as well, because they're critical. They're absolutely critical. So I don't know if any of the colleagues online, I'd actually be interested to learn whether that is a dialogue that's already started at the national level on potential for subsidies or some kind of financial support to the water utilities as we go through this very challenging time. Over.
Ironically, it has come at a time when they're asking the water utilities to be self-sufficient and be taken off as state-owned entities, which is seen as a bad word nowadays, to come off the government. Don't even say purse, they say the government nipples, as as you're suckling off the government nipples, and not recognizing that the water utilities is an expensive business. In that relation, the building back better and resilience. What you can build for a 1 in 20-year event, a 1 in 25-year event, or a 1 in 50-year event. But each time you build resilience to that high, it costs more and more. And water utilities are poor. There are infrastructure rich. If you count the infrastructure in the ground and the buildings, they're infrastructure rich. But most utilities can't even meet the replacement of 4% replacement of mains per year, so that it would have a 25-year. So what kind of horizon should resilience horizon should water utilities be building towards, to say, when you get your infrastructure damage, do you build for a 10-year replacement or 25-year replacement, or what kind of horizon should you look to in the case of resilience building?
Yeah, Alex, hi, Alex, by the way.
Right.
I think you're raising a really critical point. And, you know, first on the point of the insistence of the governments for utilities to move to that point of self-sufficiency, it is not consistent with what is happening right now under COVID-19. And I just feel that that's a discussion that needs to be placed at the policy level for some measure of consideration. The matter of the design criteria, well, as I'm not an engineer, I will not venture to give a indication on what type of return period you should be designing for, et cetera. I think that's best left to the engineers. But what I would say is that designing for investments that we're making now, they have to take into consideration the realities of what we're seeing with respect to the hazards. So, I mean, I've been at CDEMA for 20 years. And one of the things that I can tell you that is very different to when I first started working here is the reality of the intensity of the systems that we're seeing, and also the speed of the intensification. So even if you look at ETA the other day, ETA moved from a Cat 1 to almost a Cat 5. When it made a landfall in Central America, it was just shy of a Cat 5. And that was in the space of less than 24 hours. We saw it happen with Irma. We saw it happen with Maria. Look at what happened with Dorian. So the question is, can we afford not to be designing for the reality of what we're seeing with these systems that are coming with intensities that are catastrophic? And as you raise that point, I wanted to touch on another point, and that's with respect to asking the question, are we building vulnerability as we are addressing things like energy? So in a number of these GCF proposals that I was going through ahead of this meeting, one of the things I was checking to see was if there was intent for investment in renewable energy options. And I noted that a number of them are indicating that there's going to be significant investment in solar PV installations, from what I gather, with the intent of trying to offset the costs of the running of the utility, because from reading, I see that, of course, the electricity bill is a big piece of what the water utilities have to address. And at the same time, I was thinking about it because I remember after Irma's impact in Anguilla, seeing some photographs of a 1 megawatt solar PV installation that was just shredded with the passage of Irma. And I asked myself, you know, what kind of design criteria or parameters for how you're looking at installation are being considered in these types of investments that our water utilities are making now, because these are big and expensive investments. And so the question is, are these being considered even as you look at other aspects of dealing with the whole conversation on climate change and the need to move to renewables, and this is absolutely supported, but the question is, are we doing it in a way that is reducing the vulnerability of the utility? And I mean, some may argue and say that the kinds of installations that you're making in terms of the size, it's not really so much about being able to power the utility per se, because I'm getting the sense from the reading that the types of installations that are being done, they're not designing them to the size that would be required to provide the full electricity requirement for the utilities, but it's more about offsetting a cost kind of an approach. But it was just something that struck me when I was looking at the GCF proposals. Over.
Yeah, that's a very good analysis of the situation, and I think perhaps it may mean that it's some of what we are adopting have to be customized for in the context of the vulnerabilities that already existing, so that we help to mitigate any losses of these huge investments. You did mention about the response mechanism of CARELEC. The good news is that we at CAWASA, we have struggled with doing that. It has been more of an ad hoc response mechanism, but we are now trying to formalize that through what is being developed by, with support from the IDB and the CDB, called the Caribbean Water Utilities Insurance Company, QUIC. That project is now being coordinated on the consultancy by K&M Advisors, and they have made considerable progress with that, so that the insurance component, there'll be two components. One is going to be a sort of rapid response mechanism mimicking what CARELEC is doing. So we have borrowed a lot of the CARELEC response mechanism. So the first component will be to get when an event is triggered, and I can send you some more on that after this webinar, as to what I thought that maybe the consultants would have consulted you by now. But that's a work in progress. And so we're really looking eagerly to see that it can get off the ground, because it's something that is really necessary in our region. And CAWASA is pleased to be collaborating with CWWA, and that falls under the Regional Strategic Action Plan for governance and building resilience to climate change in the water sector in the Caribbean region. So I just thought I should mention that. And I don't know if our colleagues have any more questions, but I think that has been a very richly rewarding exercise this afternoon. Just that we have some of our, well, I said we normally have very good participation out of the Caymans, but I guess they are busy still cleaning up after the passage of ETA. And we have also had a couple of weeks ago some presentations during the CWWA virtual conference that was held about 2 weeks ago, both on waste and water. So I'd like to thank you very much, Ms. Riley, for taking time off and to share with us your vast experiences with CDEMA, and as we try to build resilience in not only the water sector, but within our Caribbean community. And for as you said there in your background, the resilient states and safer countries. So thank you very much. And I would like to thank all those who participated this afternoon.
Thanks very much for having me, and always a pleasure to support CAWASA. Eagerly looking forward to the conversation on the Cert support arrangements. We're happy to feed into the work of the consultants. And I also wanted to mention that we're setting up here also a Caribbean Resilient Recovery Facility. And part of that conversation is looking at how we're going to set up rosters of experts to support medium short to medium term surge support arrangements for countries during the recovery process. So that's something that we're going to be reaching out to our sectors on as we roll that out into next year as well. So thanks again.
Yeah, and okay, I just omitted just one more thing, which was very critical about when you mentioned about the comorbidities that our operators, our workers, our people in the water sector may be exposed to, and the sort of risk that we face, and the need for us to protect the people within the sector because they are very unique in terms of providing potable water and sanitation services for our people. So I think this webinar, I certainly will share it with a lot of our HR managers and our water utility managers, because I think there are so many salient points that you may raise this afternoon that we probably need about a few weeks of webinars to cover all of them. So thank you very much again, Ms. Riley. I'm Ignatius Jean, the Executive Director at CAWASA, signing off and inviting you next week to our next Wednesday webinar. Thank you very much. Goodbye.